Okay, so the first test we're going to go over here is the sulcus sign at 0. This is going to test the superior glenohumeral ligament. So you're going to get a hold of the elbow, get a hold of the coracoid with the other hand, and then you're going to give an inferior glide to that humerus. And any excess gap, you can see she's got a little bit, would be considered a positive test. And then we'll run into the next in our laxity series, which is sulcus at 90 degrees of abduction. So you're going to bring her up at 90 degrees, get a hold of the humeral head as close as you can to the joint line, and then give an inferior glide, which will test that inferior glenohumeral complex. And it's common with anterior inferior dislocations. She was pretty good there. And next up is our anterior load and shift test. So you're going to get hold of the coracoid with your non-testing hand. Testing hand is going to get a hold of the humeral head, and then it's going to push the humerus forward in anterior and medial direction, parallel to that scapular plane. That's going to test the anterior glenohumeral ligaments and capsule. Now we're going to go posterior with that to test the posterior ligaments and capsule. Going to get a hold of the front of the humeral head and drift back posterior lateral. And you're going to have a little more translation posteriorly than anteriorly. Any pain, click, excess translation is a positive test. Now we'll go into a labral tear test. This is the compression rotation test. You're going to get a hold of the scapula with your non-testing hand. Testing hand is going to get a hold of the elbow and compress that glenohumeral joint. And then from there, you're almost going to scour that joint around, just like the hip test, and just looking for any clicking, pain, kind of locking. Any of those would be indicative of a slap tear. Next part in the slap series is the anterior and posterior slide. So you're going to get the same hand positioning but no compression this time, and just slide forward. That will test for posterior slap tear. And then slide posteriorly. Humerus will roll anteriorly, and that'll test for anterior slap tear. Okay, next up we'll do a bicep test, got speed sign. So we're going to have the patient come up into 90 degrees of flexion in external rotation, and you're going to palpate the bicep with one hand and then give downward pressure with the other. Any pressure or pain on that right hand is going to indicate long head of the biceps, tendinitis, or inflammation. Another biceps test, Yergason's test. So you can get a hold of the patient's wrist and then have them rotate externally and supinate at the same time. And it's going to test the transverse humeral ligament that holds that bicep tendon in place, the long head. Any pain or problems with that is going to be a positive test and indicate laxity of that ligament. Okay, now our best labral tear test is O'Brien's. So you're going to have the patient go into cross body, almost like horizontal adduction and internal rotation. You're going to give them pressure down, and pain on the front of the shoulder or in the shoulder, and would indicate a slap tear. On top would indicate an AC problem, and then if they externally rotate and you give them pressure down and the pain goes away, it's a positive test. We have the AC shear test. You're going to get a hold of the front of the clavicle and then get a hold of that posterior scap on the spine and just compress the two together. When you give that compression, if there's excess movement or pain at the AC joint, it's indicative of degenerating joint or possibly ligamentous damage in that AC joint. We got our impingement test. This is Neers. So you're going to bring the patient up into 90 degrees of flexion, and if they get any, it's kind of a general test. If they get any pinching up front or on the side of the shoulder. It could be along here of the biceps or supraspinatus. That could possibly be impinging on that AC or coracoid ligament. We got Hawkins-Kennedy. This is more specific to the supraspinatus. So the patient is going to be in scapular plane at 90 degrees of abduction. They're just going to internally rotate them, and that's just going to jam that supraspinatus, or that greater tuberosity, into the chromium process. And you can go right into coracoid, which is going to bring them in more horizontal abduction and compress those more medial structures of the subscap and lung kind of biceps. Supraspinatus can still be tested, but you'll get a little more lateral pain with it. Now, basic test, just a crossover test. You're going to bring the patient into as much horizontal adduction as they can get, and then give a little more overpressure. And there is 4 spots of pain you're looking for with this for positive test. Anterior is long into the biceps or subscap. Lateral is supraspinatus, superior AC, and posterior infraspinatus, teres, or posterior capsule. Okay, now we have a full thickness rotator cuff tears. Drop arm 1. Bring them up into horizontal or abduction. Have them slowly lower. The positive test will be, they won't be able to hold it right through that 90-degree range. Drop arm 2 is the exact same procedure, but you'll just give them a little bit extra pop on the way down, and the arm will just collapse, and that indicates a full thickness rotator cuff tear. Now you got external lag signs. This is a partial thickness tear, so you bring them into scaption and external rotation. Back them off 5 degrees, let go of that hand that's externally rotating them. That will indicate a supraspinatus tear, or infraspinatus, sorry. If they cannot hold in abduction, indicates supraspinatus. And this is drop sign, so it's the same test basically, but just at 90-90 position. And if you let go and they internally rotate, it's indicative of a infraspinatus tear. This is internal lag sign, so this is a test for the subscap. Going to bring them back along their waistline, give them a little active overpressure, and see if they can hold that position. If they can't, it's positive. Okay, now we're into our supine test. This is the apprehension test. So you're going to bring the patient into full horizontal abduction, external rotation, and up at about 90 degrees of abduction, and you're going to see the patient give you a frayed look, which will indicate some laxity in the front of that joint. Okay, now we can go with the next part is Job's subluxation relocation test, which is basically the same thing, but you're just going to give an anterior glide, which will exaggerate that anterior drift. Pain in the front is going to indicate excess laxity. Pain in the back could indicate a internal impingement. And now you're going to do the relocation part of the Job's. So you're going to give a posterior glide, and if that pain goes away on the front or the back, it's a positive test. Okay, now we're going to posterior glide at 0, so it's going to test the posterior capsule. So you're just going to get them kind of, or this is posterior glide at 90, sorry. And you're just going to give a posterior glide to that shoulder, and excess drifting, pain, apprehension, instability. It's a posterior instability of the shoulder. Alright, another posterior glide at 0, same procedure, just at 0 degrees. You're just going to give a straight posterior glide. Any pain, apprehension, clicking, it's a positive test for posterior instability. Now we're going to the jerk test. So it's basically that same position as the last test. Now you're just going to drift them into horizontal adduction as you keep that posterior glide on. They're going to feel that thing jerk, and that humeral head will sublux out the back. You let off the pressure, it'll come back in. That's a positive test for posterior instability. Okay, now we've got a clunk test. So it's going to test for anterior-inferior labral tears. So you can have them in 90 degrees of abduction, and then from here all you're going to do is get as close as you can to the joint line, and then you're just going to give, it's almost like you're going to try and scour that humeral head around like in a clock fashion, and try and find any issues all the way from 12 all the way back around to 12 again. Any pain, clunk, pseudo-locking is positive test. This is clunk 2. So from here you're going to be in 90 degrees of abduction. You're going to give an anterior glide to the humerus, and then just ratchet your way up with posterior glide there. Pain will indicate labral issues up front. I got the crank test. So they're up in 160, and then you're going to internally rotate them, and it's going to give that same peel back mechanism that the O'Brien's tested, and they'll get the same pain symptoms, and that's another labral tear test.